Industrial operations use many different chemicals in their facilities and processes, and some of them may be hazardous to your health. To reduce your risk of personal injury or illness from exposure to hazardous chemicals, it's extremely important for you to know the potential effects of substances that you handle and take precautions to protect yourself from their hazards. In this part, we'll examine some of the chemical hazards that are found in the workplace and see how hazardous chemicals can enter or contact the body to cause injury or illness. We'll start by examining what a chemical hazard is. Chemicals can be in the form of solids, liquids, or gases. According to the Occupational Safety and Health Administration, or OSHA, a chemical is hazardous when it's a physical hazard or a health hazard. A chemical is a physical hazard if it's under high pressure, if it's flammable, or if its instability could cause an explosion or some other violent reaction. For example, this chemical is reactive. It explodes when it's mixed with water. A chemical is a health hazard, on the other hand, if it can have a direct effect on health. This includes anything from allergic reactions to disease or damage to bodily tissues and organs. For example, acids are corrosive. They can destroy your skin. Other examples of the effects of hazardous chemicals are damage to the reproductive system, blindness, and cancer. Hazardous chemicals can get into your body in any of several ways. The way that a chemical enters the body is called its route of entry. 3 routes of entry that will be discussed here are inhalation, ingestion, and absorption through the skin. When gases or particles from hazardous chemicals are inhaled or breathed in, they enter the body through the lungs. When chemicals are inhaled, the lungs themselves can become damaged, and the chemical can enter the bloodstream and cause severe health problems or death. For example, when a corrosive chemical such as chlorine is inhaled, the chlorine gas combines with water in lung tissues to form an acid that irritates and burns cells in the lungs. When hazardous chemicals are ingested or swallowed, they enter the body through the stomach, intestines, and then the bloodstream. This can cause damage to the digestive system and lead to other serious health problems or death. For example, if lead is ingested beyond the level that the body can process, it can cause paralysis and permanent damage to the kidneys, liver, and brain. Another route of entry for hazardous chemicals is absorption through the skin. Without proper protection, chemicals can penetrate the skin and enter the bloodstream, causing very serious effects. But chemicals don't have to enter the body to be hazardous. They can also cause injury by simply contacting the skin. Without proper protection, skin and eyes can be irritated or burned when they come into contact with certain chemicals. For example, if an acid gets into your eyes, it could cause permanent damage to your vision. Your body can be exposed to a chemical as a result of direct contact or any one or more of the 3 routes of entry.
If you perform maintenance on a system that includes pipes and valves, you need to know how the valve operators are constructed and how they work. Although there are many types of valve operators, we'll be focusing on the motor-driven types that are used in many large piping systems. In a high-pressure fluid system, several tons of force may be exerted on a valve stem. It wouldn't be very practical to try to operate a valve like this by hand, especially if the valve has to be positioned frequently. In this situation, a motor-driven valve operator can provide the force that's needed to open or close the valve.
The effects of exposure to health hazards can be either acute or chronic. Acute effects occur immediately and become apparent after only brief exposure. Nausea, dizziness, burns, and unconsciousness are examples of acute effects. For example, exposure to chlorine gas causes acute effects. When a person inhales chlorine gas, he or she may suddenly become unconscious. Chronic effects, however, develop from repeated exposure over a longer period of time. For example, people who work unprotected around asbestos may develop malignant tumors in the lungs only after repeated exposure, and by then, it's often too late for treatment to be effective. In this part, we looked at some of the hazards posed by chemicals used in the workplace. saw various routes of entry, and saw some of the effects that chemicals can have on the body. Now try a question on this material. In this part, we'll see how material safety data sheets, container labels, and placards can be used to identify hazardous substances and their hazardous effects in the workplace. In order to help protect workers from hazardous materials, the Occupational Safety and Health Administration, which is known as OSHA, developed the Hazard Communication Standard, or HAZCOM for short. This standard addresses the worker's right to know about any material used on the job that has been classified as hazardous. HAZCOM requires that all employers train their employees about the hazardous materials that they may be exposed to and how to work safely in the presence of these materials. One source of information about hazardous materials on the job is a document called a Material Safety Data Sheet, or MSDS. MSDS forms are not standardized. They do not necessarily all look the same. However, the information that is contained on the forms is standard. Information found on MSDS forms includes the identity of the material's physical and chemical characteristics, the nature of the hazards it presents, precautions for the safe handling and use of the material, the reactivity of the material, and specific control measures. OSHA requires that an MSDS accompany each shipment of a hazardous chemical and be available to the workers on a job. To take advantage of this OSHA requirement, make sure you know where your employer keeps the MSDS forms and use them. They can give you the information you need to protect yourself from serious damage to your health and possibly even save your life. Another way you can identify hazardous substances at your work site is by checking the labels and markings on containers. One type of label is the NFPA Fire Diamond. NFPA stands for the National Fire Protection Association. Each of the label's colors represents a different type of hazard. Red is used for fire hazards, blue for health hazards, yellow for reactivity or chemical stability, and white for unique or special hazards. The numbers in the red, blue, and yellow diamonds indicate how hazardous the substance is. The numbers 0 through 4 are used. The higher the number, the more severe the potential effects. For example, a 0 in the red diamond indicates that the chemical won't burn, while a 4 means that the chemical is highly flammable. Numbers aren't generally used in the white portion of the NFPA Fire Diamond. This area contains information about unique or special hazards. For example, the letters COR indicate that the chemical is corrosive. This symbol, or pictograph, means that no water should be used with this substance. This is another type of labeling system that uses colors and numbers. It's called the Hazardous Materials Identification System, or HMIS. As you can see, it also uses blue, red, and yellow to indicate health, fire, and reactivity hazards, and the numbers 0 through 4 to indicate the degree of hazard. The white part of this labeling system has a different function than the white part of the NFPA Fire Diamond. In the HMIS system, letters in the white section indicate the proper safety gear to use when you're working around the labeled substance. This chart shows how the white part of the label is used. The label contains a letter A through K, or the letter X. Each letter represents certain types of safety or personal protective equipment. The equipment is shown in pictographs on this chart. For example, the letter A shows that safety glasses should be worn, while G indicates that safety glasses, rubber gloves, and a respirator should be used. The letter K indicates that a self-contained breathing apparatus or an air-supplied respirator, rubber gloves, a chemical suit, and protective boots are needed. And X represents protection that doesn't fall into any of the other categories. To find out what protection is necessary, you should ask your supervisor. Other labels are required for materials that are being transported from one location to another. These are Department of Transportation, or DOT labels. DOT labels use different shapes, colors, text, symbols, and numbers to identify the hazards associated with the material. Most DOT labels are in the shape of a diamond. A few exceptions are rectangular or square. The color of the label identifies the type of hazardous material that is labeled. For example, orange is used to identify explosives, and red is used to identify flammable materials. The text that appears on the label gives additional information about the hazard, such as the word poison on this label, or the word oxidizer on this label. The numbers that are on DOT labels represent the hazard class of the material and the division of the hazard class. DOT has grouped hazardous materials into 9 different classes, and they use divisions to further group some of the classes. The division numbers indicate the degree of the hazard, with the first division being the most hazardous. Here, for example, organic peroxide, 5.2, indicates that the material is in Division 2 of Hazard Class 5. The top of a DOT label is usually reserved for a universally recognized symbol, such as the explosion symbol on this label, or this symbol that identifies a material as corrosive. In addition to labels, placards are used to identify materials. They're found on the outside of trucks and other vehicles that are carrying hazardous materials. Many placards like these contain pictographs, and they often include a 4-digit number rather than a name. This number is a United Nations identification code for the material being shipped. You may find any of these labeling systems and possibly others in your workplace. It's important to know the labels that are used on your job site and how to interpret them. If properly used, these labels can help prevent accidents, injuries, and even death. In this part, we saw how to use MSDS forms and labeling systems to identify hazardous substances in the workplace. Now is a good time to check your understanding of this material. In this topic, we examined some of the hazards that are posed by chemicals in the workplace, and we saw how material safety data sheets and various labeling systems can help you recognize the hazards in your facility. Now, try some practice questions to check your understanding of this material. In this part, we'll examine several different types of respirators and see how to use them properly. A respirator is a piece of equipment that is used to protect you from breathing hazards. Respirators prevent you from inhaling harmful dusts or gases, and some respirators also supply breathing air. You may use a respirator regularly as you perform your daily work routine, or you may use a respirator in the event of an emergency, such as a chemical leak or spill. There are different types of respirators. Each type is designed for a specific application. The one that you choose depends on such things as the nature of the hazard, the concentration of the hazardous substance, and the amount of oxygen in the atmosphere where you're working. One type of respirator is an air purifying or filtering respirator. This type uses either a half or full face mask with replaceable filter cartridges to remove hazardous substances as you inhale. Some air purifying respirators use a canister containing a filter or an adsorbent material to remove hazardous substances. Each type of canister or filter cartridge is designed for specific hazards. While some cartridges and canisters may be color-coded for certain types of hazards, the codes are not universal. Each manufacturer uses its own coding system, so don't rely on color codes to select the appropriate type of cartridge or canister. Instead, match the filter to the hazard. After a certain amount of use, cartridges and canisters become ineffective and must be replaced. So, follow your facility's procedures and the manufacturer's recommendations for their replacement. There are different types of respirators. Each type is designed for a specific application. The one that you choose depends on such things as the nature of the hazard, the concentration of the hazardous substance, and the amount of oxygen in the atmosphere where you're working. One type of respirator is an air purifying or filtering respirator. This type uses either a half or full face mask with replaceable filter cartridges to remove hazardous substances as you inhale. Some air purifying respirators use a canister containing a filter or an adsorbent material to remove hazardous substances. Each type of canister or filter cartridge is designed for specific hazards. While some cartridges and canisters may be color-coded for certain types of hazards, the codes are not universal. Each manufacturer uses its own coding system, so don't rely on color codes to select the appropriate type of cartridge or canister. Instead, match the filter to the hazard. Air purifying respirators purify air, but supplied air respirators, like the ones that these workers are wearing, supply air. The air that is supplied, of course, is already purified. Supplied air respirators are necessary in environments where a filtering respirator cannot provide adequate protection from substances in the air, or where the oxygen content in the air is low. Air is made up of oxygen, nitrogen, and trace amounts of other gases. In order to support life, the oxygen content in the air must be at least 19.5%. In environments where the oxygen content is low, a supplied air respirator is necessary. The supply of breathing air from a respirator may be contained in a portable tank connected by a hose to a face mask, or from a stationary source such as a cylinder. When you're working with an unfamiliar chemical, you should check the MSDS and approved company procedures to determine what health hazards the chemical poses and what protection you'll need to work safely. It's important to choose the right protection for the job and to use the protective equipment properly. Before a respirator is used, it must be checked for good condition and proper fit. Employers are required to establish procedures for fitting employees with respirators and procedures for testing the respirators. The employee's responsibility is to follow the fit test procedures each time the respirator is put on. Generally speaking, each time you put a respirator on, you should check its condition. You should always examine the straps, sealing surface, and gaskets for any cracks. If a respirator isn't in good condition, don't use it. Follow your facility's procedures for reporting damaged equipment. However, if it appears to be in good working order, follow the manufacturer's instructions to put the respirator on and adjust it for a comfortable fit. You should also carefully check the fit. A respirator must fit securely enough to create a seal, but not so tightly that it causes discomfort. Nothing should come between you and your respirator. Otherwise, it may not seal properly. This includes the respirator straps. They should go over your head, not your hard hat. Fit testing includes performing two checks. One is a positive pressure or exhalation check, and the other is a negative pressure or inhalation check. Let's look at a positive pressure check first. To begin the positive pressure check, you need to block off the air outlet for the respirator. Exactly how this is done varies depending on the type of respirator that's being used. For this respirator, the air outlet can be sealed off with your hand. Then, you exhale and maintain pressure that forces the facepiece outward away from your face. Pressure in this direction is called positive pressure. The facepiece should bulge out slightly from your face. If the respirator fits properly, you should not feel any leaks around the sides of the facepiece. If there are no leaks, you should perform the negative pressure test. To perform a negative pressure check on this respirator, you place your hands over the air inlets. Then, inhale and hold your breath to establish a negative pressure inside the facepiece. Negative pressure pulls the mask against your face. If the respirator fits properly, it should hold the suction inside the facepiece as long as you block off the air inlets, and there should be no leaks around the sides of the facepiece. If the respirator fails either of the fit tests, readjust the straps or harness on the respirator and repeat both checks. If after several readjustments you still can't get it to pass both tests, you should not use the respirator. Follow your facility's procedures for reporting defective equipment. These two fit tests apply to respirators that you use as part of your work. Some facilities may supply emergency escape respirators for use during emergencies. Your responsibility is to know where to find emergency escape respirators in your work area and how to use them safely. It's important to remember that even the best protective equipment is of no value to you unless you do 4 things. Use it properly, inspect it regularly, care for it properly, and never alter it in any way. In this part, we looked at several types of respirators and saw how to use them properly. Now is a good time to try a question on this material. In this part, we'll see clothing and equipment that can protect your skin and eyes from chemicals that can cause damage upon contact or enter the body by being absorbed through the skin. Protective clothing and equipment are often referred to as personal protection equipment, or PPE. OSHA has established guidelines for personal protection equipment. In this program, we'll discuss only the protective clothing and equipment that are related to protection from chemical health hazards. When working with unfamiliar chemicals, you should check the MSDS, the chemicals label, and company procedures to determine the type of PPE that you need to work safely. When selecting the appropriate personal protection equipment necessary to work safely with hazardous chemicals, you'll have to determine what parts of your body are susceptible to exposure. In some instances, your eyes will be at risk. The most effective way to protect your eyes is to wear safety goggles. Goggles provide protection from all directions because they totally enclose your eyes. There are several different types of goggles, and each type is designed for specific limited applications. For instance, some types of goggles are better at protecting against dusts and fumes, while other types of goggles are better suited to protect you from splashing liquids or flying particles. So make sure you choose the right type of goggles for the hazard. And the goggles must be in good condition and fitted properly. Most goggles can be adjusted so that they fit snugly against the face. Some jobs require that a face shield be worn along with goggles to protect all of the face. A face shield is designed primarily to protect your face from flying particles or splashing liquids, but it is also considered as a secondary means of protection for your eyes. To protect your body from hazardous chemicals, there are several types of clothing that can be worn. For instance, a chemical-resistant apron may be worn when you're handling corrosive or irritating liquids. The apron protects you from liquid that could splash and burn your skin or clothes. For even more protection, you may have to wear clothing that covers your whole body, such as this chemical suit. Chemical suits and other types of protective clothing can be made from a number of materials. Each material is rated and approved for different types of chemical hazards. While some materials can protect you from hazardous liquids, other materials are designed to protect you from gases or dusts. To select the appropriate material for a particular hazard, you use the material's rating to match the suit to the hazard. For instance, this outfit is designed to provide protection from dust and particulates such as asbestos. In a situation where you need protection from both splashing and gas, a vapor-tight, totally encapsulating suit with a respirator must be worn. Along with a chemical suit, chemical boots are frequently worn over steel-toed boots. The type of boot depends on the type of contamination. Disposable boots protect your boots and your skin against exposure to dirt, dusts, and other contamination, while rubberized or chemical boots protect against exposure to liquid contamination. To prevent chemicals from entering the boot, your pant legs should be outside the boots and sealed with tape or elastic. If tape is used to create the seal, make a tab at the end of the tape. The tab will help you get the tape off when your work is done. Another part of protecting your skin is wearing the appropriate type of gloves. Again, it's important to select the right type of protection for the job. The gloves protect your hands the same way that chemical-resistant boots protect your feet. For additional protection, inner gloves are often worn under the outer ones. When you're wearing chemical-resistant clothing, your sleeves and gloves should overlap. This will prevent exposure to airborne particles and any liquids that could get inside the glove. Sometimes, sleeves are taped to the gloves to form a seal. Tape can be hard to handle when you're wearing gloves, so you may need help taping your gloves and sleeves together. And don't forget to add tabs to the tape. They'll come in handy later. When the job is complete and you're ready to remove your protective clothing, be sure that you follow proper handling procedures for the contaminated clothing. Clothing that was exposed to certain hazardous chemicals will have to be carefully disposed of, and other clothing may require special treatment to remove contamination. Some types of contamination even require you to shower before you enter a non-contaminated area. Be sure you know the hazards and follow approved procedures for handling protective clothing that has been exposed to a contaminated area. In this part, we saw how you can protect yourself from hazardous chemicals that could be absorbed through your skin or cause damage upon contacting your skin or your eyes. Now is a good time to try a question on this material. In this part, we'll examine strategies for responding to emergencies such as unintentional chemical spills and releases and accidental fires. An important step in chemical safety is prevention. You should know the hazards of the chemicals that are being used or stored in your area. If you're unfamiliar with a chemical, you should always check the MSDS to find out what safe handling procedures are necessary and what protective gear you need. But even with strategies for prevention in place, accidents such as fires, releases, and spills can occasionally occur. So it's important for you to know how to recognize and respond to such emergencies. You can find out how to respond to various situations by consulting your company's Emergency Action Plan. The Emergency Action Plan provides employees with details on escape routes, staging areas, and emergency-related instructions. It's important that you know these procedures before an emergency arises. When the emergency is fire, you'll need to know where the alarms are, where the exits are, and who should be notified. If a company fire brigade has been formed, learn how to contact them. All of this information should be included in your company's emergency action plan. Keep in mind that there are hazards associated with fire other than the obvious ones related to heat and smoke. For instance, many chemicals that are flammable are also toxic. When they burn, they emit poisonous gases. If company procedures allow, and if you're properly trained, you may need to put a fire out. Before you attempt to extinguish a fire, however, you should take into consideration the size and nature of the fire and what type of extinguisher to use. Fires are divided into 4 classes, and there are different types of extinguishers for each class. Using the wrong type of extinguisher could actually make a fire worse. There are 4 areas of emergency response that we will cover here: recognition, containment or exit, notification, and first aid. First step in responding to an emergency is recognizing the hazard. We've all seen fire before, so in most cases we know how to recognize it. Other hazards, however, may not be so easily recognizable. For instance, is this spill simply water, or is it something much more dangerous, such as acid? Actually, it's hydrofluoric acid, an extremely corrosive chemical, and its cleanup requires trained personnel and specialized safety equipment. Because some chemicals can look deceivingly innocent, it's important to treat all unidentified substances as if they are extremely hazardous. Some chemicals do provide clues to their hazards, but to be able to detect these clues, you have to be familiar with the chemical's normal properties. Then, when something abnormal occurs, you'll be able to recognize any potential problems that might exist. One property that can indicate a problem is the chemical's appearance. If a substance has changed in color or density, or if it looks abnormal in any other way, do not handle the substance. Follow your company's procedure to report the condition and determine why the change occurred. Like appearance, odor is a basic physical property that may help identify a hazardous situation. Many chemicals have characteristic odors, such as hydrogen sulfide, for example. Some chemicals do provide clues to their hazards, but to be able to detect these clues, you have to be familiar with the chemical's normal properties. Then, when something abnormal occurs, you'll be able to recognize any potential problems that might exist. One property that can indicate a problem is the chemical's appearance. If a substance has changed in color or density, or if it looks abnormal in any other way, do not handle the substance. Follow your company's procedure to report the condition and determine why the change occurred. The rotten egg smell of hydrogen sulfide gas can provide a warning that there's an emergency. While it's extremely unsafe to inhale chemicals to identify them, you may notice an unexpected odor. This is often a warning that there's been an uncontrolled release of material from a container, storage vessel, pipeline, or other area. In this situation, you should follow procedures in your company's emergency action plan. An abnormal odor could also provide warning of an emergency. An abnormal odor can indicate that a material has been altered or contaminated in some way and could be unsafe to use. It's important to remember that you should never purposely smell a hazardous substance as a way of identifying it. The substance that's emitting the odor could be highly toxic or even lethal. When a hazardous situation has been identified, then you need to either try to contain the situation or get out immediately. Getting out immediately means just that. It does not include helping coworkers. OSHA regulations prohibit workers from assisting stranded personnel during an emergency that requires an immediate exit. Anyone left inside must be rescued by trained personnel with the appropriate PPE. If the emergency is an uncontrolled release of a substance, the escape procedure will depend on the density of the vapor that has been released, among other things. Vapor density indicates whether a gas is lighter than air or heavier than air. Materials that have a high vapor density tend to flow down into low-lying areas. Liquid propane gas is an example of a material with a high vapor density, so it will fall in the atmosphere. And materials that have low vapor densities tend to flow upward into the atmosphere from their point of release. Methane is an example of a gas that has a low vapor density, and it will rise in the atmosphere. It's important that you follow your company's emergency action plan in any situation, and you must know where your facility's escape respirators are stored in case a respirator is needed to safely exit an exposed area. After you've exited the exposed area, you should immediately notify the appropriate personnel. A specially trained crew may be required to rescue victims, pinpoint the source of the leak, and stop the leak. If the hazard is a spill, a specially trained crew may be needed to build a dike to control the flow of the spill, or to remove the chemical with an absorbent substance. Again, it's crucial to know the chemical. Even a small spill could result in fire, a violent reaction with another chemical, or a release of dangerous gas. If the nature of the hazard doesn't require an immediate exit, make sure that you know your facility's procedure for handling the situation. Generally, the response to such a hazard includes blocking off or marking the area and notifying appropriate personnel. In this part, we saw some strategies for responding to accidental fires, releases, and spills. Now is a good time to try a question on this material. In this topic, we looked at personal protection equipment and emergency response procedures that can reduce or eliminate the risks associated with hazardous chemicals on the job. Now, try some practice questions on this material.
When the control room reports that a motor-operated valve isn't functioning normally, a technician will have to troubleshoot to find out whether the problem is in the electrical circuits, the switches, the mechanical components of the valve, or the mechanical components of the motor operator. It's especially important to remember that electrical problems within a motor operator can create an electrical shock hazard. The technician has to take the valve and the motor operator out of service and place them in a condition that allows them to be worked on safely. During troubleshooting, the technician takes a systematic approach to identifying and solving the problem. He makes notes about the conditions he finds and the actions he takes to correct them. Often, he'll have to complete a report about what he observes and what actions he takes. Some important clues for troubleshooting can be found in the control room and by talking to the control room personnel. To find out if there's an electrical problem, the technician can start by looking at the indicator lights. In this setup, there are 2 valves and 2 motor operators. Each valve has 2 indicator lights associated with it. If valve operation is normal, but one indicator doesn't light, the problem might be the indicator lamp, or it might be the wiring. If the valve doesn't operate normally and one of its 2 lights is out, the problem might be in the motor operator's limit switch or in the switch wiring. The switch might be out of adjustment, or the switch might not be actuating because the valve isn't completing the stroke when it opens or closes. If both indicator lights for a valve are out, the technician should follow approved electrical troubleshooting procedures to identify an apparent problem in the motor operator's electrical supply circuit. But in this case, both lights are on, indicating that electrical power is okay and that the valve started to open or close. Something stopped valve movement before the stroke was complete.